a huge uptick in cases in BC.
We do have 8 actually new cases within the last day.
But the number that has health officials most concerned is one particular case. A woman with no travel history.
So now we need to find out, okay, she hasn't traveled. There's nobody in her family, immediate family, that's traveled. So where did she pick this up?
This is Canada's first apparent case of the COVID-19 virus spreading in the community.
There's likely at least one other person out there who's either had this disease or has this disease, and we need to find them. 4
of the new cases announced today are linked to the same household and to a patient who was identified last week, a man in his 60s who had traveled from Iran.
And they had been under observation and monitoring, and they developed their symptoms while in isolation.
Another man and woman have also tested positive upon returning from Iran, bringing the total number of cases linked to that country in this province to 13. And the last case is a visitor from Seattle, where 11 people have died from the virus.
Campus is closed. We have no idea what's happening.
In Vancouver, students showed up at this private university to find it closed, at least until March 8th, after a student came down with what's believed to be COVID-19.
Well, I definitely have concerns now. I mean, at least that you can say is everyone uses the elevator and touches the buttons, right?
The university says the student's father recently tested positive for the virus and had traveled from overseas.
So 8 new cases, one of them of unknown origin. Does that change, Tina, the way BC officials are responding?
Well, we'll find out more about that tomorrow. They're holding a briefing to discuss how they're going to respond. BC now has 21 cases, the most severe, a woman in her 80s who's in critical condition at the hospital. Now, despite this new case of apparent community transmission, the worry is still from abroad. The province's top doctor warning that international travel is risky.
All right, Tina, thanks very much.